Hi, everyone, and welcome to today's webinar, How to Work with Local Leaders to Declare Racism a Public Health Crisis, brought to you by the Network for Public Health Law. I'm Maddie Kim, the Public Health Associate at the Network's National Office in Northern Region, and I will be your host for today's webinar. Just a quick note that both the presentation slides and video playback for this webinar will be available on the Network's website shortly after the conclusion of today's event. We strongly encourage attendee participation, so feel free to submit questions at any time during this webinar by using the Q&A tab on the right-hand side of your screen. All you need to do is click on that tab, select all panelists from the drop-down menu, and send us your question. We'll be addressing them towards the end of today's event. Your moderator for today's webinar is Dawn Hunter. Dawn is the director of the Network's Southeastern Region. You'll also be hearing from Amanda Merck, who is the Research Area Specialist for Salute America. You'll also be hearing from Lindsay Grove, the President of League of Women Voters at St. Petersburg area. And Dawn will be leading us through the rest of today's webinar, so Dawn, over to you.
Hi, everyone. I'm going to take a moment to share my screen. And I see that people are still joining. I'm really excited to see the turnout today. I just want to start by saying thanks to Salute America and to Amanda for jointly hosting and crafting today's webinar, and thanks to Dr. Grove for participating and talking about some of the work in St. Petersburg, Florida, which of course I'm a little bit biased about because that's where I live, but also they've been doing some great work here. There's been some great work going on here to advance racial equity. So I'm going to use my time to talk about some recent developments in addressing racism from a public health perspective and some trends, and to talk about a new collaborative. So this is just a high-level recap that in April of 2020, there were 9 declarations that we were aware of. And then by November of 2020, that number had increased dramatically to over 200. And that now and another 27 were added through October of 2021. I think there have been a few added on here and there. I heard about one, I think, in Washington State that just happened maybe within the past few days. But clearly the bulk of the declarations were issued in November, which of course, as we know, makes sense given that this was early in the pandemic, before vaccines. We were seeing such a huge disproportionate impact on people of color and older people due to COVID. And then we also were on the follow-up kind of months to the racial justice protests that started in May of 2020. This image here is actually from Alex Hill, who is a GIS director at Wayne State University, who has maintained this map of where resolutions and declarations have occurred across the US. At the network, we've spent some time looking at just state and local government level declarations. And so what you see here is a map of the network by region and the numbers that we've looked at. So in some ways, to make it easier to go through them, we've broken them down by region and then analyzed them. So we've read almost all of the ones that are out there. And then have one issue brief that was issued on the Southeastern region. And we have one coming out soon on the Northern region. And we're also currently working on our Eastern region. So you'll see those come out in the next couple of months. But in addition to state and local government entities, it's also important to note that professional associations, insurers, hospitals and health systems, universities, and so many other partners have also declared racism a public health crisis. So if you've seen me present before, you may have seen this list, but it's important to note these are public health associations, medical associations. Blue Cross Blue Shield has been one of the leading insurers to come out and announce major financial investments in racial equity in the communities that they serve. A number of healthcare systems, Healthcare Anchor Network, I believe, was one of the first, as was Chicago. And a number of universities. You see here, this is just a handful. There are definitely others. And I mention this because it's important to recognize that that the work that we do, we can have a greater impact when we work collectively and realize that we're all trying to advance the greater good of achieving health equity and racial equity in our communities. And so some of the sectors and partners you see here are really important to engage. Higher education, which you saw on the previous slide, law enforcement, the faith community, legal services organizations, et cetera. All of these partners, organizations, sectors have a role to play. And then it's important to emphasize that we have to have relationships with people before we need to rely on them. So if you're not in the business of getting out and making connections and just having a relationship with some of these partners in these sectors, it's a great idea to get out there and start doing it. So as part of our analysis at the network, we have looked at the operative statements and local declarations, and that is just the section that says, therefore be it resolved that we're going to do X, Y, and Z. So here are some of the X, Y, and Z. Some of the typical components that we see are a clear declaration, of course, that racism is a public health crisis or emergency. So in our analysis, we've intentionally not looked at declarations that only are anti-hate crime or racist acts in their communities, very specifically saying racism is a public health crisis or emergency. Measures pertaining to organizational policy or practice, and these are things like HR hiring and retention and promotion practices, other internal policies, workforce training, etc. Emphasis on partnerships and collaboration. So a lot of declarations acknowledge the need to partner and commit to working with key partners in their communities to help implement the declarations. Accountability measures. So these are there are fewer references to these in the declarations that we've reviewed, but these are things like committing to a specific date or creating like a task force or committing to write a report by a certain time. So in other words, ways to show the community that you are doing the thing that you said you were going to do. Focus on a specific issue. So in some declarations, there are references to things like adverse childhood experiences, data, Black Mamas Matter, and they're often very specific to the community. And then importantly, a lot of these end with a call to action to other state, local, and national leaders to also declare racism a public health crisis. And the last category, but one of the most important, is funding and infrastructure. Of course, we can't do this work without money and without people and without other resources to engage in racial equity work. So more recently at the network, we have done an analysis of declarations through a healthy aging lens. And that means we looked at how these declarations talk about aging across the lifespan and issues that impact our health, not just in our own lifetime, but across generations. And so this is a graph here of the percentage of declarations that contain the identified words on the left here. This is from an analysis of 211 declarations that we completed reviewing in November of last year with my colleague Betsy Lawson. And you see here the highest references, the most frequent references were to diversity, equity, inclusion, and implicit bias and related trainings, workshops, requirements for the workforce. Environmental hazards and climate. So this is often recognition of the environmental hazards that have led to adverse health outcomes, particularly due to COVID. And I should also note that this was not just in the operative section. So these terms were anywhere in the declaration. Premature mortality and death and life expectancy, which of course we know are impacted by racism. And we see differences by race and ethnicity significantly in the US. And even just talking about racism across generations occurs in about 25% of the declarations that we reviewed. Other important concepts including chronic stress and trauma and adverse childhood experiences, which I mentioned. Interestingly enough, despite the fact that we know there was a huge disparity for older populations related to COVID, very few of these declarations mention that fact. And almost, what is this? It's like 8%. Very few of them even mention the words age or aging. And then there are some other specific population groups referenced, and only a handful that reference COVID disparities by age. And the other interesting facts there is that they talk about disparities among younger populations where they do reference them. So really interesting findings here. We're hoping to publish this within the next month or so. So there are three common threads that we kind of noticed across these preamble statements. And that this is the whereas statements, right? The why of issuing your declaration. And that's that racism affects lifelong health outcomes, even before birth and across every stage of our lives. It also significantly reduces life expectancy and increases premature mortality. And in fact, so many of the declarations recognize the fact that racism across the social determinants of health has led to worse outcomes across the board for Black Hispanic or Latino, and American Indian people. And unequal access to opportunity affects economic stability, home ownership, and intergenerational wealth accumulation. So we know just how much the economy drives outcomes and how income inequality in the United States in particular affects outcomes. And I don't know about you, but here in Florida, the housing market continues to be hot, but it's also pricing people out of the market, and lower income people can't even live near the places that they work. And we also don't have adequate public transportation. So all these problems compound. So you're going to hear more in today's webinar about how to operationalize declarations. So I'm not going to go too deep into these, but there are a few common recommendations that I like to make. One is that we have to focus on community in ways that community members can engage in and participate and influence decision-making. And that includes budgets. Thinking about equity, not just as an outcome, but also as the way that you do business. So having an entire framework for your operations, not just one department or one office, or one person, but it becomes the way your entire organization operates. Building workforce capacity, which, as you saw on the slide with the aging data, that was one of the top terms included, but things related to anti-racism, trauma-informed care, culturally appropriate services, et cetera. And then reviewing, revising, and I can't even see my own slide here, addressing and enacting laws and policies that address specific health issues. Data, of course, we know has been really important. And so considering ways that we can better standardize data collection, promote data sharing, and use data to inform decision-making. Thinking about infrastructure. So again, those offices, positions, staffing to support this work. Very specific recommendation around racial equity impact assessments, and then designing specific interventions for the social determinants of health. So I'm going to skip this because I want to make sure that the other speakers have a lot of time to talk, because they have so many great things to share, but you'll get a copy of these slides. And these are some of the takeaways from our research and from the research of some of our partners. What I'm really excited to share with you is about where can you find resources, connections, and guidance on your work to advance health and racial equity and anti-racism action. Later today, you're going to see this website go live, the Collaborative for Anti-Racism and Equity at antiracismandhealth.org. It is going to be live later today. So don't check it out yet, but check it out later on. We're going to send you a reminder. But one of the objectives of this is to streamline access to information and resources, to facilitate connections between partners working in this space, anywhere that they're working on this space, centering and amplifying community-led efforts and community-generated ideas, and informing legal and policy solutions. This collaborative has a group of core partners that have been meeting over the course of the past year to think about how we do this work. And so all the partners you see here have been critical to helping to make bring this website to life, and also just continuing to partner and advance the work of addressing racism from a public health perspective. Salute America, of course, is our co-host today, but all the partners you see here have contributed and are leaders in this space. It's not just us, though, and I want to mention that there are so many partners doing this work. A couple of other ones that come to mind are Big Cities Health Coalition and the National Academy for State Health Policy. But what have we done in the last year? We have expanded from 5 core partners and a small group of people meeting to 10 partners. We hosted 2 interactive workshops last year on how to move from declaration to action. We developed the website, which we're so excited to launch today, and we have supported each other's projects and amplified each other's work, which was one of the original reasons that we came together. So what we're doing in 2022, we want to emphasize the fact that racism harms all of us, and we all have a role to play in dismantling racism and other forms of structural discrimination. So I should put a check mark by launching a website, but continuing to develop and offer workshops, providing technical assistance, creating a space for learning and connection, which is really important, and informing the narrative about health equity, racial equity, and anti-racism action in the way that we communicate. So when you get to the website, check out the resources. Every partner has key resources that their organization has put out linked there. You can ask us questions. You can submit an idea, a resource, or connection. Is there something that we're missing or someone we should know? Let us know. Suggest a law, policy, or best practice to highlight. We want to amplify the work that everyone's doing and put it all in one place, so you don't have to go looking around the internet or the interwebs, as I like to say, to go find this information, right? So you can kind of have a one-stop shop for information about what you can be doing in your community, no matter where you are on this journey. and join a learning community. We want to create a space for partners to have conversations and learn from each other, including us. We are all in the process of learning. So check out the contact us page when you go there. So some examples of resources that you'll find: Public Health Law Center has a lot of work on equity and inclusion. They're one of the partners that's highlighted. And ASTO is another partner, especially for state health departments. They have a policy statement on achieving optimal health for all by eliminating structural racism. That you can, it's here, so you'll have these slides, but you can also access this policy statement online, and they're currently finding ways to help health departments implement this. And then just launched Racism as a Public Health Crisis from Declaration to Action, examples of action. So this is endingracism.apha.org. This is from our APHA, one of our other partners. And right now they're highlighting 6 communities across the US that have taken significant actions to implement their declaration. So you can check that out. It just launched, I think, within the past week. So that's it for me. I'm really looking forward to questions. I'll be moderating questions at the end, but now I'm going to turn it over to Dr. Lindsay Grove to share more about the work in St. Petersburg, Florida.
Thank you so much, Dawn. And I'm really, really excited to share our information about our own work here in the Sunshine City. So I am Lindsay Grove. I am the president of the League of Women Voters here in the St. Petersburg area. I'm also an active public health practitioner. So I'm really excited to share sort of how both of these passions intersect and have produced the work that we've been doing here in the St. Petersburg area. So just to give you a little bit of background about St. Petersburg, we are the 5th most populous city in the state of Florida. We are a part of the Tampa Bay area, and we're actually the 2nd largest city besides Tampa in the Tampa Bay region. And St. Petersburg is very geographically segregated. If you have lived here or if you're familiar with St. Petersburg, the city is really split into North St. Pete, which is typically has more of the wider population, and then South St. Pete, which is, has a lot more Black and brown folks. Then of course you have the beaches, which are certainly a lot more white and more affluent. And then of course we have wider Pinellas County, which St. Petersburg is in. It is not the county seat. Clearwater is actually the county seat for Pinellas. It is the most densely populated county in Florida. We're not geographically big, but we have close to 1 million people here. And really the boundaries for our municipalities, which there are 24, are really just roads. So it's just one continuous urban environment here in Pinellas County. So as you can imagine, working not only with a municipality amongst many municipalities, as well as now working with the county, can be really complicated and includes a lot of different stakeholders. We're really fortunate to be able to work with the Foundation for a Healthy St. Pete. This was a foundation that was created out of the sale of a hospital here in St. Petersburg and is a community benefit foundation. We've also been working with the Black Health Equity Alliance and Unite Pinellas to really push for these resolutions to be passed. These are obviously very St. Pete centric organizations, which is why we started in St. Pete. But as we've moved to working at the county level, we've been looking at partners across Pinellas County as well. So the journey was definitely not a straight shot, as most journeys are when we're doing advocacy work. Our biggest first step was really finding somebody within City Council to really be our champion. And we picked Councilmember Amy Foster as our champion. She is a white woman. We really felt like it was important to show solidarity among white council members, even though we do have, of course, Black council members in the city of St. Petersburg. And one thing that we did find was ensuring that everybody was on the same page, because there was some miscommunication with folks. Hey, why didn't you ask me to be the champion? Or, hey, this is something I'm really passionate about. Why haven't you talked to me about this? So I think one of the lessons that we definitely learned, at least in the very first step, the process of finding a champion, was ensuring that everybody was on the same page, and that it was really understood, who would be sort of the lead on that. And again, Dawn talked a lot during her presentation about the importance of making sure that you have good relationships with folks. And I think that's one of the reasons why we were able to mitigate that first step. As Councilwoman Foster took this resolution forward, one of the very first things that barriers that we encountered was the legal department, which I think is a great discussion as we're talking with the Network for Public Health Law. The legal department took one look at our resolution, which was about 3.5 pages, and said, whoa, this seems like there could be some liabilities. And so they basically completely stripped our resolution down to less than a page. And really what they took out of the resolution was all of the historical things that have happened in St. Petersburg. We have had lynchings in this area, not just in St. Pete, but in Pinellas County. We've had lawsuits, historically here. Our municipal and sewage workers actually staged a really significant strike and sued the city for discrimination based on race, and won. So we wanted to highlight all of the instances of why racism is a public health crisis through a historical lens, and that was in our resolution. But the legal department took one look at that and said, whoa, this feels like, we're admitting to something and we could be liable for it. Unfortunately, we actually didn't get a copy of the revised legal department's resolution until it was actually added to the city council agenda. And I actually happened to be looking at the agenda. I'd been sort of tracking the, council meetings to see when our resolution was coming up. And I had, saw the revised version and said, hold up, this is not what we agreed on. So we as a coalition made the decision to actually pull it from the agenda, because we really wanted to make sure that we were true to what we were trying to achieve with this resolution. So it was removed. We had a very frank talk with Councilmember Foster about, why we wanted to pull it, why it was really important that these historical instances be included in the resolution. And as we communicated that, we sort of learned that we really needed that we needed to really express how much we wanted to be involved in the process. And so we actually worked with legal and said, hey, we negotiated with them on the resolution. We're very fortunate to have other counties in the area, specifically Hillsborough County, which is across the bay, that's where Tampa is, and Manatee County, which is south of us, who had passed similar resolutions. And we said, listen, those resolutions went through those legal departments and they're now passed. So, there's precedent for local governments to be able to pass these things and not face any kind of lawsuit. So we got through that part. It was assigned to the Youth and Family Services Committee. I don't really understand why or how they assign committee or resolutions for committees. So that was a really interesting process. Youth and Family Services unanimously approved it. And then it actually got onto the consent agenda as a part of the Youth and Family Services report in the city council agenda. And if you're not familiar with what a consent agenda is, it's basically, things that are non-controversial that, we can just, that city council feels that they can just pass and not really typically have to discuss. So it was kind of without a lot of pomp and circumstance that the resolution was passed as a part of the consent agenda, which was really exciting for us because, of course, we believe that this is a non-controversial item because racism is a public health crisis. And because it passed, of course, one of the things that we asked the city clerk was that it be sent on to the county, onto actually the school board as well, and the other municipalities in Pinellas County. So, and that kind of, will lead into our county discussion. But these, again, are just some lessons learned. We wanted to make sure that we talk to all council members first to keep them in the loop. It's important that, especially something like this where a lot of council members were really supportive, which was great, but they wanted to feel like they were contributing. So we definitely applied that as we are working with the county. We wanted to make sure that we're providing folks with plenty of information. We're very fortunate to have a lot of great folks on our coalition that were willing to write, white papers and short policy briefs for folks to understand why this was important. Also make sure that, you're on the lookout for the legal department and that you're working with the legal department. They may not necessarily be familiar with resolutions like this. And it's an opportunity to provide education to the legal department so that they also feel comfortable as they're looking at resolutions. And again, don't be afraid to stand firm. We were nervous because we were like, well, we really want this to get passed, but we just feel like a lot of what was really important and that was painful, but also vital for folks to really understand why this was a crisis. Having that stripped out, I think really made the resolution feel not authentic to what we were trying to do. So I'm glad that we ended up actually standing firm on the language of the resolution, and eventually, like, we were able to negotiate a resolution that we all felt good about. I also think it's really important, and Dawn talked about this in her presentation, but making sure to add recommendations that are realistic. We wanted to make sure we had to actually really understand city government and what was possible within the departments that were existent, right? What is realistic? Where can we fit, recommendations within the current city government? And in fact, the recommendations that we put out were actually echoed later on in a structural racism study that was done in the city as well. And so it was kind of cool to see the recommendations sort of being built upon and really pushed forward, which also were a part of recommendations, actually not recommendations, but city charter amendments that focused on equity. So we all kind of, had these recommendations that then also sort of really encouraged and supported city charter amendments to create an equity office, to create equity funding. Unfortunately, those did not get passed in the last local election, but we're hoping that, having sort of this movement forward, the new administration will be interested in actually pursuing the recommendations. And also partnerships, making sure that you're working with lots of different folks in the community to really build a grassroots movement to put pressure on council members. Yes, it's great to have council members that are supportive, but it's also really important for them to know that they're supported, and to also let folks that are on the fence know that the community wants this. That's also extremely important. And that actually really feeds into what we're trying to do at the city, at the county level. The city clerk actually did send a copy of the resolution to county administration, and Commissioner Renee Flowers decided to move forward with the resolution, which we did not know. I mean, we had already said that we were going to, move forward with the county. So we actually were kind of moving parallel to each other until we started, meeting with county commissioners, and then figured out that, hey, this was already in the works. And so, we were able to work with Commissioner Flowers for her to become our champion, since she was already in the process, which was great. We actually also wanted to meet with administration. So we met with the Office of Human Rights, because we wanted to sort of see, like, what kind of work is already being done as a part of the Office of Human Rights. And if a resolution like this, comes forward, what does that mean for this office in particular? What is we wanted really some feedback on, hey, does this make sense? Is this something that, you feel like, based on your work within county administration, that it would be something that the commission and administration would support? And interestingly enough, we got some interesting hesitation from the Office of Human Rights. They were really nervous about even the use of the word racism in a resolution. So that actually really helped us as we were meeting with commissioners to sort of see where they were at with this kind of language. And we're still in the process right now of meeting with the county commission. We have a couple more meetings left, and it's been, mostly received very positively. We have had a couple of commissioners that are resistant, very nervous about using racism, and feeling like it's a very negative thing. So we've had to really do some education and really some work to build a coalition, not just of grassroots folks, but also really talking with commissioners, helping them feel more comfortable with the work that we're trying to do and why this resolution is important, how it fits with what their constituents want. And we are also working again with the legal department. We have looked at some of their edits and have definitely had some hesitation with moving forward with the resolution that they've put forward. So we're currently negotiating that with them. But we're glad that we caught it this time versus, having to pull it and then redo it. So that's where we're currently at with Pinellas County. And this is sort of our next steps. We have to come to an agreement with legal. Again, we have a couple more meetings with commissioners. There is some interest in actually having a workshop with commissioners to talk about the resolution. So we're definitely monitoring that to see when and if that happens. And of course, we're beginning to engage our community partners to start putting pressure on commissioners to pass the resolution. And yeah, we're really hoping that, if we can do a lot of the front end work, it'll be a little bit more smooth sailing at the end. So we can easily pass it. So that's really what's been going on here in Pinellas County. I do want to say just, before I hand it off to Amanda, that, Florida gets a bad rap, but there are pockets of us here that are really working hard to advance racial equity and health equity. And I think that, we're really just trying to do the work at the local level. And I think that's really important, a really important place to start. So that's my contact information. And without further ado, I will hand it off to Amanda Merck.
Hi, thanks so much. Okay, thanks again. So my name's Amanda Merck. I'm a research area specialist with Salute America. We're a Latino health equity communications program. So we share the latest research, resources, and examples of policy change to make communities healthier for Latinos and for all people. We're based at University of Texas Health in San Antonio. So today I'm going to go over an action pack that we recently launched on our website to help communities in drafting and adopting these resolutions to declare racism a public health crisis. So we kind of have these 4 steps in our action pack, and there's the link to it. So before we get into our action pack, though, before those 4 steps, we have a few things that we kind of provide first. So before you get started, we have these frequently asked questions, a bunch of examples. We've got a guidebook on considering how to frame inequities within the context of systemic racism. We share a case study from Buncombe County, and then we offer technical assistance along the way. So for example, with our FAQs, these are just some of the questions that we provide in there with answers to each of them, just to think through for yourself and for your partners, but also to anticipate questions that the people you're going to bring this idea to that they may have and how to potentially respond to them. And then with our guidebook, we kind of walk through, we have these like 4 considerations for how to frame systemic racism and how that impacts public health. So it's sharing local data on health outcomes, of course, disaggregating them by race, ethnicity, by income, and by education. And then within those health outcomes is briefly explaining kind of the social determinants of health literature and how these non-medical factors impact our health. And then framing inequities in those social determinants of health. So in those social environmental conditions in which people live, framing health inequities within the context of with historical inequities within those living conditions. And then framing them how those conditions came to be, typically racist, classist, discriminatory practices that created those unequal living conditions. So in our guidebook, we use the example of infant mortality, and that we kind of use this to go through these 4 steps to show how you could use this one particular health outcome in framing health inequities in this one step. Let's see, and so here's kind of a quick example using infant mortality. So with sharing data, that first step at the city county level, disaggregated by race, ethnicity, income, education. I'm explaining how these risk factors for infant mortality include it's the living conditions, it's these neighborhood conditions, these non-medical factors, how segregation, environmental pollutants, various aspects in the neighborhood, like access to healthy food, and then how these are connected to there's inequities in those situations. So inequities in those neighborhood conditions, and then the racist classist practices behind them, such as the specific racist classist practices behind segregation. Let's see. And so, as Dawn mentioned, as Lindsay mentioned, Dawn mentioned specifically in Florida too, where people can't afford to live near where they work, and they're facing inadequate public transportation. So that's one example. In our guidebook, we kind of provide these examples of the real life context that people are living through due to discriminatory practices that created unequal neighborhood living, working conditions. And so I'm going to kind of just run through them. So say, for example, you've got a young pregnant woman right now, but a few years ago, she opted to get a GED her senior year rather than attend her high school, which had very low high school graduation rates. That high school was known for its low reading and math proficiency. It was known for high teen pregnancy rates. It was known for high school to prison pipeline. So she opted to get her GED instead of being exposed to that environment, which then of course, she's often overlooked for jobs in the future. Now at age 22, she's living in a low-income neighborhood, and it's maybe adjacent to a neighborhood that has high vacancy rates, maybe high crime rates, but this is because this is all she can afford because of housing and land use practices in her community that have banned affordable and mixed housing on a majority of land zoned for residential. So it's limited her options to find affordable housing, leaving her exposed to, underperforming or worse neighborhoods. Although it's not a great neighborhood, it's still expensive, especially when compared to her annual household income. So the only place she could find it's inefficient. She's dealing with mold, she's dealing with lead. It's accounting for 40% of her income. That's before utilities, and because it's inefficient, it's going to charge more. So now she's burdened by housing costs, burdened by utilities, and she can't afford to own a personal vehicle. This is a huge problem because her neighborhood's a food desert or food swamp simultaneously. Without a vehicle, she's going to have to decide, is she going to walk 10 minutes to the bus stop and then take the 30-minute bus to a supermarket where she can get, affordable, nutritious food? Or is she going to just walk the same kind of 10 minutes to a convenience store where they're not going to have produce and all the staples are basically going to be double the cost? Not having a vehicle is also a problem when considering access to community, to higher education or to workforce developments. But even with higher education, so the community college there might have a tuition reimbursement program, but that program, it's not covering those remedial classes that someone coming from an underperforming high school is going to need. So that's going to double the time she has to invest in higher ed, plus the cost. And these tuition reimbursements just don't cover those remedial courses. Also, these tuition reimbursement program in our community requires this down payment up front, and she just can't do that. So although this program exists, it really just doesn't work. Same with their city has a new workforce development program. She's unable to enroll in it because she has a retail job that has that weekly kind of shift schedules, and she needs to keep her schedule flexible to get as many shifts as she can. So she's unable to plan for programs like a workforce development program long-term because she has to keep a flexible, ever-changing weekly schedule for work. She's not eligible for Medicaid because her state has not adopted Medicaid expansion. Her employer doesn't provide sick leave or healthcare coverage, so she's having to skip hours at work and forego wages and risk employment security if she needs preventative care like prenatal visits. She could get fired from her job because she's late because of the bus transfer. It's a hour commute for her to get there. She's got to transfer in the middle. If that's late, she's late to work. And that's because public transit is underfunded in her community. She's looked for overlooked for other jobs because, again, so she chose to get the GED. And then because she doesn't have a vehicle, and that's often a requirement on job applications. It's a requirement that you own a personal vehicle. And her little brother is facing the same situation in high school, just to even apply for internship programs. They're requiring high school students to own a personal vehicle just to participate in that internship program. So she decides she has to purchase a personal vehicle. Now she's vulnerable to predatory lending. She's also vulnerable to unreliable vehicle that's affordable, which could still cause her to be late to work. This could still threaten her employment security. But then now she's also exposed to these additional costs, not only vehicle ownership, but also maintenance and repairs. So now she's having to forego food, medications to pay for these repairs. And it hasn't really even taken care of that initial problem of buses being late because she still might be late. So overall, and this is kind of transportation focused examples I'm giving right now, but overall she's facing numerous stressors because she's constantly having to navigate just participating in the workforce around an unreliable vehicle, infrequent or unreliable buses, or burdening friends and family for rides. Again, this is all just to get to work. So we provide these examples, and this is to illustrate sort of these more upstream factors that we are more interested in focusing on and changing and what we want to address in these resolutions. So of course, these examples, of course, on the ground, we need these case workers that are helping her address these immediate social needs right now. So we need that. But this collaborative on anti-racism and equity, everything within our action pack is all really framed around thinking about these more upstream kind of systemic issues. Okay, so I spent a little bit longer on those examples than I meant to. But then here's just a quick quote. It's a great reminder of how health outcomes like infant mortality are connected to these bigger systemic inequities. Okay, so the FAQs, this guidebook, this is all before the 4 steps in our action pack. So now the 4 steps in our action pack are connecting with community advocates. And as Dawn and Lindsay both mentioned, it's important, you've got to have relationships with these community leaders and these organizations. So in our toolkit, we provide guidance on finding them. Maybe you have relationships with some of them, maybe you don't. And so we provide ways to think about some of these unique partners with some overlapping interests, just to make sure everyone's at the table. We provide a model email to reach out to them if maybe this is a new relationship you're trying to develop. And then we provide talking points to help introduce this issue. And then, of course, as I mentioned in the previous steps, we've got the FAQs and the guidebook. So here's kind of just a quick example of the sample email. We give you guidance on some language that's already included, but also what to include yourself to personalize it. So the second step is creating a working draft of this resolution. So you get these partners together, you're working on a draft resolution. And as Dawn showed, they have lots of tools for some kind of typical components that these resolutions include. In ours, we kind of broke it down in the 2 steps. You've got you can use our guidebook, again, that we mentioned before, but then we also have specific considerations for drafting the resolution. And this is going to include 2 key components. So you've got the preamble or whereas statements and the operative or the resolution statements. And this is, again, just to focus on kind of bigger systemic upstream changes. And so the preamble section is geared towards helping establish this foundation upon which you're going to want to build consensus for the strategic actions that you're going to include in the operative section. So again, Dawn mentioned some of these. And then Lindsay also mentioned that they had included these, and then that they got pulled out from the drafts. And they had to kind of work together to redraft it to include some of this stuff in. But, you know, is acknowledging the history of racism. I'm calling that out. Linking to data on health outcomes, as well as inequities in these social and environmental living conditions. Acknowledging the role jurisdictions play, establishing a vision. And then all of this is to build consensus for the operative section. And these are going to be those strategic actions, those specific commitments to do something, to address these problems, to address these underlying beliefs. This is going to be a kind of a mental shift. But to uproot the systemic issues that perpetuate these like systemic policies and practices that continue to perpetuate inequities in health, and then also to facilitate healing. So here's a quick example. I don't want to spend too much time on this. Dawn mentioned also in their analysis they've done, they show what kind of typical components are included in these resolutions specific to specific action. And here's an example of some. And so in our action pack, in this, we also link to what Dawn mentioned, and we link to these other resources that these partner organizations that are all part of this collaborative on anti-racism and equity, on resources that they've shared to build up this section of your resolution. Okay, so you've got your community partners, drafted your drafting, which is going to be an ongoing process, especially as lessons learned that Lindsay shared, is considering leaders at different levels of government. So, I mean, approach city and county at the same time. And in our action pack, we provide some tools to help with that. We provide guidance on finding these local leaders. Again, we provide that model email. And we also provide these social media messages. But then, of course, as Lindsay mentioned, and it looks different in every community, they could take this and then make these changes, not let you know, and put it on the agenda and vote on it. And you don't know that they're maybe voting on a watering down version. So as Lindsay mentioned, part of this step is to stay connected with them. Maybe you've got to keep an eye on the agenda. Maybe it's going to come up without you knowing. Maybe they will alert you in advance. But staying kind of on top of this to make sure that as this process moves forward, whichever draft of the resolution they're putting forward is one that you and all the community partners you've been working with are happy with. And then this last step is building community support. Last step, building community support. So we have these tools. Oh, I'm skipping. Okay, sorry. The tools we have here is again, kind of model emails, and then these social media messages. And this step is to help, as Lindsay mentioned also, is you have some folks that are maybe sitting on the fence. This is to help show them that this is something the community wants also. So building that community to support, to send emails, to call, to tag on social media, these local leaders that says, yes, we really do support this resolution. We're glad you've taken it this far. Like, please vote on it, put it on the consent agenda. So those are the 4 steps of our action pack and various components of resources that we provide within them. And then we also are here to provide some technical assistance on the way. So you're welcome to reach out if you have any questions as you go through the process. And then overall, I just kind of want to say that all efforts, should be inclusive of the needs of Latinos and other people of color. All efforts should be representative of existing inequities. And then everything needs to be responsibly evaluated and measured moving forward. So feel free, please, to reach out to us. Here's our contact information. And then I'm going to pass it over to Dawn to open it up for if y'all have questions for Lindsay, Dawn, or myself.
Thank you, Amanda. Thank you, Lindsay, for those excellent presentations. So much actionable information that I hope people are listening to. I saw in the chat too, some Florida counties and cities maybe represented on today's webinar. So we just have a few minutes left. So we really wanted to get information to you. And a couple of the questions that came in are, Lindsay, can you share both the resolution that passed in St. Pete and the white papers or position papers that the committee members developed?
Yes, I can do that. I think what might work best, I'll quickly put together a Google folder and then just share that with the resolution and with our paper.
Great, thank you. And then I wonder if this question might have been answered a little bit. And so Lonnie, as it looks like you asked this question, but is there a difference between connecting with advocates, Amanda, which is step one, and building community support, or how do you share the contrast between those two? I think you might have answered that, but I don't know if you want to add to that.
Oh, sure. I guess connecting with community advocates are going to be some of those key champions who are going to help actually drafting the language of the resolution and bringing this issue to local decision makers. And then that's the first step. And then the fourth step, building community support, is going to be after kind of the bulk of the work has been done. This is to get more folks kind of in the general public or people who weren't involved in that key action to say, yes, we support this also. So it wasn't just, you know, these 5 groups that were part of it. Like, this is bigger, the bigger, broader community also supports this and would like to see City Council take these actions. I hope that helps.
Great. So the next question, I see one came in the chat. We got one that came in before, so I'm going to do that one first. This is a question we get all the time, no matter where we are presenting and what we are presenting on, which is almost, it seems like, how do you talk about racism who aren't comfortable? How do you talk about racism with people who aren't comfortable talking about racism? So we heard Lindsay talk about that a little bit. Amanda, I don't know which one of you might want to add or tackle that question first.
I can tackle it just from, so Pinellas is a very, very diverse county. And like I said, St. Petersburg and actually other parts of Pinellas are really geographically segregated. You know, for us, this is where relationships are really important, because once you sort of build those relationships with electeds, you understand like what their priorities are, and you can sort of take what their priorities are and think about how you can make an argument for why racism is important to them and to their constituents. And I also think that it's really important as white folks, I identify as a white woman, for us to have these conversations with other white people to make it so that they begin to become more comfortable talking about racism. I think it's meeting people where they're at. So that's been our strategy.
Yeah. I think part of the way I don't know, it's been helpful to approach it is, one is for sure to ensure you're not using any like individual blaming language. Like we're not calling the specific head of a specific department racist. We're not calling anyone racist. It's really drawing attention to historic discriminatory practices. I think is a huge part, is making there is a distinction between implicit racism, of course, and explicit racism, both of which definitely very much exist today. But I think it's been helpful in focusing on the policy change, which is what we're geared towards, is to focus on the systems and not the people right now. Of course, one action would be to include, you know, workforce training on implicit racism and those individual kind of aspects of bringing about this kind of change. But I think it's really going back to the history of acknowledging the history of discriminatory practices and how that's baked into current policies and practices today. And then also is being sure to connect with, I just totally blanked on what I was going to say. Oh my gosh.
That's okay. That happens to me all the time.
So not talking about individuals, talking about the systems, calling it out. Yep, not coming back.
While it may come back to you, and we'll let your brain work on that. I will just add, I agree with what was said. One of the things I want to add is that at the network, we do a training called Becoming Better Messengers, where we talk about values-based messaging. So I just want to emphasize, in addition to what you've already heard, is the importance of relationship building and connecting with people before you, ask them to engage in behavior change or ask them to adopt a way of thinking or being. That it's really important that we just listen to people to understand, as opposed to trying to change their minds. And when we think about values, connecting with people on shared values. I like to say in our training, people want to know that you care before they care what you know. I cannot take credit for that. I heard it somewhere else and I thought it was amazing. But I think it's really important to remember that, people want to have a relationship and connection with you and are more likely to take action when they have a relationship with someone, or they have some kind of emotional or value-based investment in that person or in that community. So that's all I would add to that. I think you can talk about values that are related to racism and racial equity without even using those terms. Of course, we want to keep using those terms to normalize the conversation about how racism affects health. But we also recognize that, especially with some policymakers and then in general community members and other people may not be ready to go there, but they may want to talk about economic opportunity, and they may want to talk about the importance of a quality education and access to education, right? So we can find things and ways to connect.
Yeah. So sorry, I just remembered I was going to mention also with these conversations about racism is also making that connection to classism. So maybe racism may seem a bit more implicit, which may be harder for some people to wrap their minds around or to get behind, but also calling out this explicit classism that we have. Oftentimes, a lot of these racist practices from the past, they exist today under the guise of classism. And if we think about a lot of land use issues, a lot of zoning, a lot of single family zoning, a lot of school finance was based on segregation. And now, even though it's technically illegal, for those practices to be rooted in racism, those practices are perpetuated in explicit classism today, of explicitly excluding low-income populations from physical geographic presence, but also just participation and access to opportunity. So making that connection to that next step to, okay, maybe it is under the technical, legal, like specific word of the law today, it's not legal, but under classism it is.
So in our last 2 minutes, I just want to remind folks who are still on the call that antiracismandhealth.org is live. That is the website for the Collaborative for Anti-Racism and Equity. I hope I did this group justice. I just want to say how amazing all of the partners in this group have been, coming together all on our own time, because we all are invested in advancing health equity and racial equity and anti-racism work. There are so many great resources, many of which you heard about here today, that are linked on that website, so please check it out. You can also contact us. We're happy to support you in your efforts to implement declarations in your communities. And we really appreciate everyone participating in this conversation, and we hope that you're able to take this information back, share it with others, and also that it can help inform the work that you're doing wherever you are in the world right now. So thank you again to Amanda and to Lindsay. So grateful for you for being here today. And quick question, will the Google Doc link be shared via email? I think it was shared in the Q&A, right? It was shared in the Q&A box, so before you hop off, open up your Q&A and the link to the Google folder is there. I will try to, yes, okay. Thanks everyone so much for your time and have a great afternoon.